Hello everyone, my name is Araceli Delgadillo, and today I will be presenting my IRB proposal presentation. The purpose of this research study is to examine if vitamin C supplementation lowers total serum cholesterol levels in men. And the reason that I focused on the male population is because as I was conducting my literature review, a lot of the studies that have examined this topic have been done on males. And that is why I decided to focus on this population. The second reason is because my dad has elevated cholesterol levels and he also has a heart condition. And so that is another reason that prompted me to examine this particular topic in the male population. So first we're going to start off with an introduction. We know that vitamin C is a water-soluble vitamin, and it's also known as ascorbic acid, and it's commonly found in fruits and vegetables. And on the slide, you can see some good sources, food sources of vitamin C. We also, up on the slide, have the recommended dietary allowances for men, women, pregnant women, and lactating women. So what are some of the roles of vitamin C in the body? So the first is maintenance of collagen. So collagen is a principal component of skin, bone, teeth, tendons, cartilage, and it's also a principal component of blood vessels and also of heart valves. Vitamin C helps absorb non-heme iron in the body. Healing and regeneration of the wounds is a critical role that vitamin C plays in our body. Vitamin C is also known as an antioxidant, and it helps to neutralize free radicals. And some of the reasons that we want to make sure that free radicals are neutralized is because they are associated with different diseases such as cancer, Alzheimer's disease, and cardiovascular disease. And another very important role of vitamin C is it aids in the synthesis of neurotransmitters. Next, we're going to talk about what can happen if you experience a deficiency or a toxicity of vitamin C. So first, if you have a deficiency, you can see a result of that being scurvy. And scurvy is characterized by bleeding gums and opening of previously healed wounds. And it is possible to develop scurvy in as little as 1 month with little or no vitamin C intake. The second possible consequence of having a deficiency of vitamin C is a slow recovery from infection and poor wound healing. Collagen synthesis can become impaired, and this also weakens different connective tissues within the body. Now, because vitamin C is a water-soluble vitamin, the excess is flushed out of the body in urine. So really developing a toxicity can be rare because, again, the body can flush out the excess in the urine. But if you did have a toxicity of vitamin C, some very common symptoms that you can experience are abdominal cramps, headache, vomiting, and diarrhea. So a lot of gastrointestinal issues. So what is the rationale of this proposed study? So first of all, elevated cholesterol levels are a risk for developing cardiovascular disease. It is estimated that in the United States, 36.6 million Americans have a total serum cholesterol level of greater than 200 milligrams per deciliter. Now, with our cholesterol levels that are greater than 240 milligrams per deciliter are considered high, and cholesterol levels that fall in the range of 200 to 239 milligrams per deciliter are considered borderline high. It is estimated that less than half of the adults that have elevated cholesterol are currently receiving treatment. So through my literature review for this study, There was a gap in the research that was identified with regards to the role of vitamin C and vitamin C supplementation and its effects on lowering cholesterol. And so because of this gap that was found in the literature, this allows for my proposed research study to add to the body of knowledge regarding this topic. There were several studies that did show a relationship between vitamin C supplementation and lower total cholesterol levels. Several studies also showed that there was a link between low serum levels of vitamin C in the body and how this had the ability to increase our risk of developing cardiovascular disease. So what exactly is the relationship between vitamin C and cardiovascular disease? Well, several studies found that vitamin C plays a very critical role in the maintenance and the health of the endothelium. The endothelium is the tissue that forms a single layer of cells, and it lines various organs. And the endothelium is found within the blood vessels and also the heart lymphatic vessels. And one last finding through the literature review is that vitamin C plays a very critical role in preventing the endothelial dysfunction. And endothelial dysfunction is actually the earliest sign of cardiovascular disease. So next we're moving on to our methods and procedures portion of my study. So I will be conducting a randomized single-blind placebo-controlled study. And the reason that I chose the single-blind placebo is because me as a researcher, I will not introduce further bias in this study. So therefore, there is no need for me, the researcher, to also be blind during the study. We will have an intervention group and we will also have a control group. And the intervention group will receive 500 milligrams per deciliter of a vitamin C supplement one time a day for 12 weeks. And the control group will not. They will only be receiving a placebo pill. Participants will be randomly assigned to either an intervention or a control group. There is a function in Excel that I plan to utilize, and this is a random number function, and this random number function will create random numbers, and all of the participants will be assigned a number, and based on that number, again, they will be placed into either the control group or the intervention group. For this study, I will be collaborating with Valley Health Team, and they are located in San Joaquin, California. And the reason that I chose Valley Health Team as a collaborator in my study is because I actually volunteer at the health center 2 times a week. So therefore, I have established a relationship with clinic staff and also with the chief medical officer, which is who I would be receiving authorization from in order to carry out the study at the health center. Subject recruitment. So I will be recruiting men between the ages of 42 and 82 years of age. And the reason that I chose this age range is because, again, through the literature review, many of the studies that had already taken place honed in on this age group. I am going to be recruiting participants who have a total serum cholesterol level of greater than 200 milligrams per deciliter. And I will recruit the patients with the help of the physicians at the health center. So the physicians at the health center, they obviously know their patients better than I know them. So they will actually make the initial contact and they will let the patients know that there is a study that is going to be taking place and that we are going to be studying cholesterol and the effect of vitamin C supplementation on cholesterol levels. And so they will actually be the first point of contact with the patients. After they have initiated the conversation that there's a study going on, I as a researcher will come in and schedule a meeting with the participants and go into further detail about what the study entails. After the 12 weeks, when the study is completed, we will go ahead and have the patients take a lipid panel. And one thing that I did forget to mention is that we are going to be including patients in this study who have a recent lipid panel test on file. So the lipid panel test will be no older than 3 months. And again, I'm using that 3-month mark based on things that I found during my literature review. I will have a total of 220 participants. I did utilize the G-Power software to help me calculate the number of subjects that I will be needing for the study, and it actually suggested 210. However, I will round up to 220 to make sure that I have room for those who decide to no longer participate in the study. So for my data analysis, I will be conducting a pre-test, post-test control group design. And the reason that I'm using this design is because this is the most rigorous and it's often referred to as the gold standard, and it's very often utilized in randomized clinical trials. The pre-test, post-test control group design rules out most threats, internal and external validity. The data will be analyzed quantitatively because there will be a measurement of change in the total serum cholesterol levels. So we definitely want to see what those numbers were prior to the vitamin C supplementation and after the vitamin C supplementation. The G-Power software will be utilized to analyze the data. A paired t-test will be used, and the t-test is actually considered more powerful. The paired t-test is considered more powerful than the independent sample t-test because there is less variability. So discussion. So for my research study, I really am hoping that the results can serve as a tool for advancing medical knowledge about vitamin C supplementation and its potential effect on lowering cholesterol levels. I'm also looking to just provide more information for doctors and also for patients who suffer from high cholesterol. I'm hoping that vitamin C can be used as a treatment option for high cholesterol should my results show that it indeed is beneficial with lowering cholesterol levels. And I'm also hoping that through the study, we can show what dosage of vitamin C supplementation is safe, and also the effectiveness of vitamin C as a therapy for getting cholesterol levels under control. And here is my reference slide. I want to thank you all very much today for your time, and have a great day.